Ma'am, we have done the live. Let me know whenever you are ready. We'll start.
Okay, I'm ready.
So I'll start. We have few people who have joined in already. Okay, so hello everybody. Thank you so much for joining in, and a very, very good morning to everybody who have joined in. And thank you for taking out time and being here with us. And also, thank you so much, Dr. Shweta. We are so grateful to have you here. Thank you for saying yes to for this webinar. And I'm very sure the people who have joined, they are also very excited and looking forward for the presentation. So before we go ahead, I would like to formally introduce Dr. Shweta. So give me 1 minute for that. So everybody, Shweta is a psychologist with over 15 years of experience across mental health, wellness, parenting, and education. She holds a MA in psychology, a PG diploma in counseling, a PhD in psychology, and a PG diploma in clinical hypnotherapy. She has worked extensively with children, teens, and adults, offering a safe and supportive space for healing and growth. An ICSSR fellow, Dr. Sharma specializes in stress, anxiety, depression, relationship concern, grief, inner child healing, and self development. Her career span role as a professor of psychology, child psychologist, psychotherapist, corporate wellness consult, and online therapy expert. She has also led numerous workshops on life skill, emotional intelligence, mental health, psychological first aid, and hypnosis, and Indian psychology. So, thank you so much, ma'am, for being here. And now I would invite you to take the presentation forward.
Thank you, Parajita. Thank you, AHA Therapy. It's my honor that I'll be speaking after Dr. Palan. He is my teacher and mentor when it comes to hypnotherapy. So, this paper of mine or this discussion of mine is actually an attempt to share my journey of New Age hypnosis and what I understand as New Age hypnosis. I would be very, interested if we can have some kind of discussion at the end, or if people are having any queries, also they can ask. Do we can interact with them in the session also, or it will be only after the.
Ma'am, let's do after the session. So anybody, if you have any question, they can note it down, and by the end of the session, we'll be taking Q&A, and during that time, we can have the discussion and the questions.
Okay, fair enough. So before we begin, I'll just, so my presentation is actually divided into two paragraphs, two basic portions. So one is about what is New Age, and then what is New Age hypnosis or hypnotherapy. So what is New Age? For that, we'll begin. So when we all are in psychology, the goal for psychology remain the same for all of us. Reveal the mysteries of inner world with the hope of solving men's problem and maximizing its effectiveness. When I also joined psychology, this is my quest that I want to know more about human behavior and what are the basic understanding of human behavior, mind, mood, emotions, thoughts, right? This is how I came into psychology. And when I entered the psychology, I studied my diploma in counseling and therapy. So that was, I was trained in Western psychology precisely, where, we'll talk about the Western side, where, you start with the Freud and the Adler and the Jung. All the basic premises are being taught. But then simultaneously, when I worked with clients, I also realized that, there is a gap. Gap as in like, okay, we can deal with anxiety and depression with CBT, with behavior therapy. But still, the deep down, there is something that's not allowing them to heal. So, something unconscious, subconscious things are also intervening or coming in between. And when it comes to the healing, also, people are not able to heal, right? So the healing was not, of course, we can work with the Western psychology, we can work with, symptom reduction. There's a lot of research the scientific research which was carried out by the Western psychologists, but still the healing part was missing. So here we'll be talking about what is New Age, right? Before we understand what is a hypnosis itself. Okay, so this is a little background about how the Western, or how all of us actually started. We'll not talk about more of the Asian thing, but how we all started. So in the West, for many years, the role of mind was ignored as a major contributing factor to physical health. Right? It was the Dr. Sigmund Freud only in late 18s when he started that there is a mind play in health and wellness. And then this process the elevated the status and the scientific credibility of the field in psychiatry and in psychology. So gradually they also realize the limitation. Then later also, is it visible to all of you?
Yes, ma'am, it is visible.
Okay, so when they studied more onto it, they realized that there is a fight and flight response reaction, how the body is also reacting. That is how we have, gone through the process, when it was no mind to fight and flight, when we are recognizing the physiology and the mind is also, playing a part in your thought process. Then there was a time when it came, like, Maslow came, the positive psychology field came, where people are talking about, that how the positive emotions and how we can incorporate and how we need to focus more on the strength and the positive emotions of your human being. And that's where we came to clinical hypnosis, right? So it's a process, it's a journey from we started from no mind to mental well-being, right? So this is also about the history and about the psychology has gone through the changes the psychology has gone through in terms of the research and the outcome. Though the initial first wave of psychology was behaviorism, which was more dominated by the Skinner and the Pavlov, that how you can learn to move with it, you can learn to change the behavior. Then it was a second wave where people started analyzing that there is a mind is also playing a part in it. Your affect, your emotions, your thought process is actually contributing to your behavior, and we need to analyze that from where exactly it is coming. Then now there is a new shift, the third wave, which we say, or we say the new age, which is talking about the ACT, the acceptance theory, right? The relational frame theory. Then we have DBT. Then we have CVT, CFT. CFT is actually compassion focused therapy, right? So we can see that there is, we are approaching or we are progressing into the new age. Why there is a shift, why there is a need for the third wave? So the need for third wave is because the mainstream psychology was not able to explain certain concepts like intuitions, like transcendent experiences, deep emotional traumas and healing, and the altered state of consciousness. People have observed that people get into different states of consciousness. How about meditation, the meaning making and the purpose? It was not clear when we talk about the mainstream psychology over there. And the spontaneous behavioral changes and subconscious transformation, these were the things which was not explained by the mainstream psychology past then. And that is how the new researchers came up, and it is we are talking about it in 2025, but these kind of researchers has already been started in somewhere around 80s. So it's already 50, almost like 50 to 60 years where they have actually worked on, researched on, when they started reading about the yoga and the meditation, yoga nidra. That is where they realize that, because of course I will credit the scientific community of the West, that they have started working on these concepts, and now we realize that it is important. So that is how the hypnosis actually, come from the West. We'll come to it that how it is actually an Eastern concept. But initially it came from the West that, okay, if we want to answer these questions, we need to understand about the altered state of consciousness. We need to understand about the subconscious transformation. And that's how they come up with the clinical evidence based therapy called hypnosis, right? Which has a good set of research when it comes to the physiological aspect of it. So, the clinical hypnosis and plus our new age, both of these is getting the influence from the transpersonal psychology like Maslow and all the positive psychology movement. It is also getting the influence and input from the consciousness studies. It is getting the influence from the mindfulness and the contemplative sciences. Of course, hypnotherapy and altered state research, the positive psychology, indigenous and Eastern psychology. That is also where we'll be focusing more on. That they have learned a lot from our Vedas, from our scriptures as well, and the system and the quantum theory. So they have done research in science, they have done research in psychology, and this new age is actually a combination of the quantum theory and the psychology of the consciousness. It is combination of all. So new age psychology referred to a contemporary integrative approach to understanding the mind that combines scientific research and spiritual and experiential and conscious based perspective. It also regard a person as a holistic person where it is not only just body but also the mind, which is cognitive and emotional, spiritual, and of course the environmental, that is a social and cultural aspect of it. So earlier, we used to just consider this as just mind and body initially, right? But then there are few theories come which talks about that, okay, environment is also shaping the person, and it is actually a correlated thing, a transactional thing. So, the goal of New Age, the primary aim is not just merely symptom reduction, but also expansion of consciousness and the inner transformation. Because that is how we are moving from the symptom reduction to more of the transformation. We are expanding that how we can increase the brain power, how we can expand our knowledge. This is actually the purpose of education, is that we how we can expand our knowledge, how we can become limitless. Right now we are limited, but how we can become limitless. And I think with the quantum science, quantum physics research also, this has been proved that everybody is connected on the energy level. And this also has been talked about in the new age. So a lot of these researchers has combined and has also contributed to the new age psychology, which is also taking care of the quantum side of the physics and also about our eastern scripture knowledge of mind and body. If you want to understand the new age or the third wave, we can also take a metaphor where consider a metaphor of river, where the first wave, which is a behavior therapy, is like you're controlling the river, and you are just thinking about that how to build the barrier, how to learn to swim, how to control your movement. This is how you're controlling the behavior. So you change what you can see. Then the second wave, when the cognitive behavior therapy came, you started studying the river. That okay, now you begin to analyze that why the current is so strong. Is the water really dangerous or just looks scary? Right? It is your mental perception or what? And how much my interpretations are accurate. So the focus changed from how you think about the river. Initially, it was how the river looks like. Now, the third wave, which is a mindfulness and ACT and DBT focused or compassion focused movement came, the third wave, new age so called, it's about, flowing with the river. So now you realize you cannot stop the river, but you can learn to move with it. So you learn the mindfulness, you learn the acceptance, you learn, about the value based navigation. And this will change your relationship with the river. And that is why, we are becoming more tuned in with ourselves. If you will also see, this is what the basic premises of Indian philosophy. That first you realize who you are, right? First understand who you are. So you change the relationship with the river so that you can flow with the life. And this is where we all are moving with the new age, right? So this is about the new age. Again, the goal of new age is not just symptom reduction, but the inner transformation. The goal is also about the self awareness, about knowing yourself, emotional integration, healing of the subconscious pattern, and alignment with the values and purpose. We also realize that, when we talk about the Western, all of us, most of us were actually trained in the Western psychology. While their value system, their belief system is quite different from our value and our belief system. And somewhere when we are talking about the new age, we are also integrating a lot of belief based psychology. What I believe is also governed by where I was born with, right? So my culture actually contribute a lot in my belief. So it is also about the spiritual growth and the mind body harmony. So synthesizing science and spirituality is the goal of new age. We are just not focusing on the science and not focused just on spirituality. We need to bring the good combination of it, more logical combination. It is also a combination of quantum mechanics and meditation. So this is all about, what actually the new age is, where the shift is coming from, accepting a bigger view, a holistic view. Now, what is hypnosis and hypnotherapy? So I assume that, our viewer have already seen the presentation and the talk from Dr. Palan. He is actually a great person when it comes to hypnotherapy because he has actually integrated both of these things. And I'm actually fortunate enough to speak with and learn from Dr. Palan. There are also Dr. Bhaskar Vyas, who is very good in Ericksonian indirect method of hypnosis. Dr. Dipankar Patra and late Dr. Rajni Vyas. I would like to, it is compulsory to bring their names, so that I can share my gratitude with them. Right. So, what is hypnosis? Again, just from a layman perspective, also I'm explaining here. So, hypnosis is a method by which a person can be guided into an altered state of consciousness called the trance state. It is characterized by the deep state relaxation with increased suggestibility. So you will also see that when you are stressed out, we understand from the stress mechanism that when you are stressed, nothing, your prefrontal cortex is not working, your logical mind is not working. And of course, when your logical mind is more activated, when you are in the deep state of relaxation, your suggestibility and your, motivation, improves when you want to work with your inner problem because your wisdom center is activated, and that is what is being utilized in the hypnotherapy, right? So we get into the trance state, we call it induction, and it is characterized by the deep state relaxation with increased suggestibility. In this state one may achieve physical and psychological changes that are seemingly beyond one's normal conscious capability, right? And the psychological therapy done in conjunction with the hypnotic trance state is called the hypnotherapy. So, there is also a cognitive hypnotherapy where we incorporate the component of the cognitive therapy, the cognitive behavior therapy, with the hypnotherapy or with the hypnosis. So, both can be conjuncted and then we get a greater result. So it is actually the combination of the mind and body and incorporating your subconscious status of mind also into the therapy. So this is new age hypnosis. So the new age hypnosis usually refer to a blend of not only just the traditional hypnotherapy technique with concept from the new age movement where we are focusing on the mindfulness and such as healing, spirituality, mindfulness and metaphysical practices. It goes beyond classical hypnosis, which is often called a clinical therapy, to include the spiritual growth, self discovery, and holistic healing. New Age is also relooking into the world of psychotherapy into more humane, subjective, and transcendental experience. A New Age hypnosis is using indirect suggestions which are based on the principle of observation, utilization of the client conscious and the unconscious behavior. Now, here it is very important that the new age hypnosis, we are using the clinical hypnosis as well, and we are also using the indirect method of hypnosis, which is an Ericksonian method of hypnosis, which use a lot of the client's behavior and unconscious behavior, subconscious behavior, and it is very much of the belief based thing. So, you are not only just doing something which is scripted, but also going beyond the script or the visualization, because we are using the person also an active, contributor in their own therapy. Now, the new age physiology. What actually is, how it is impacting the physiology? That is very important because we all are from the psychology community. So we understand that we need to understand from the logical perspective. So we have started with the biosocial model. When we started doing our Western psychology, we started with biosocial model. But now the new age physiology or new age psychology is talking about the psychoneuroendocrine immunology, which means that it says that every cellular is interacting in your body, right? It is not just the psychological thought and emotion which is interacting, but it's I would say that it is like your computer virus. So how you think about certain things, right, will impact your illness, and your illness again will contribute how you think about it. So it's a transactional thing which is happening, and every time you have a thought in your mind, every time your thought is related with an emotion, it is also secreting, it is also you know correlating with your neural system of the body. It is also interacting with your endocrine system of the body, and so all of these things are involved, and it is impacting your immunology, your immunity of the body as well. So now the new ICD actually recognized that starting from the common cold to cancer, everything is psychosomatic. This is also new age, right? And since we also started realizing that there is something called the cellular healing. So we know is okay. So, as a psychologist, it's important to note that stress often comes from the inner conflict and distorted thinking. And this is where, our whole focus is that initially we did not realize that how much important the inner conflict and inner stresses are. But now we understand this in a physiological way as well, which can actually create and worsen the illness. Even the ancient texts like Charak Samhita also says that the most of the disease actually arise from the error in judgment or the understanding. So a distorted way of perceiving the world can create stress. So that's where your perception actually comes in picture. As I just mentioned, just like the computer virus that can corrupt and erase the data. Emotions and thoughts are carried through the blood and involve many chemicals like hormones and neurotransmitters. And when we do not process those experiences or any traumatic experiences properly, it gets pushed into the unconscious mind. The unconscious mind act like a hidden engine that influence the body constantly. And hypnosis actually works by assessing these unconscious information. So, the research says that it's a two-way, connection between the brain, hormone, immune system. And when we want to heal somebody, of course, we need to see the integrated model of the body and mind. So, if we want to heal somebody completely, we must access the memories and the emotional pattern stored in the unconscious mind. This is the basic idea of New Age and also about the hypnotherapy. So, a hypnotherapist help client to access these deep and state dependent memories, and then healing become multidimensional, biological, psychological, and even spiritual. So healing begins when we understand our belief system also and thought pattern. So with the cognitive therapy, we used to understand only about the thought pattern, but with the new age incorporation, we also incorporate our belief system, that where we have started growing up. So during hypnosis, actually, what will happen is that during hypnosis, the brain become more flexible and create new neural connections. Even the brain scans show that the hypnosis can change old conditioned pathway and create a positive internal transformation. And the prefrontal cortex become more and more active, improving emotional control. And as you know that the brain controls everything, it controls our healing as well, when you give that conducive environment to it. And that is the basic idea. So here we are talking also about the cellular healing. So when you have, you know, gave the power to your brain, the prefrontal cortex, that you can control, it also control a cellular healing. How does it control? So we all know now that your body has a capacity to homeostasis. Means that it actually ability to heal itself on a cellular basis. And what we need the conducive environment for it. So hypnosis actually provide when we activate our subconscious and uh, unconscious matter, which is connected with the quantum mechanics as well, right? The potential of transformation, body itself start healing. As you all have must seen that so many people have healed themselves and transformed themselves. But some behavior, of course, with some behavior, but the behavior is guided by the belief of self healing and self help, where they could activate their cellular healing. A lot of people must have observed this also. Some people would need a little help and direction, but some people do it themselves. And this kind of conducive environment is created by the deep meditation or the deep therapeutic state like hypnosis. It can redirect the body's healing potential, and this healing comes from the power of the immune system. The unconscious mind can understand and transform message in the way the conscious mind cannot. So when we give this kind of deep state hypnosis, deep state meditation, you know, it not only connect all our internal organs nicely, it also give the cellular healing, the potential for the cellular healing, and also create a homeostasis at the molecular and the systematic level. Right? I cannot see the presentation. Parajit.
Yes, just give me 1 second. I think it's automatically changing. Just a sec.
Mhm.
Are you able to see now?
Yes, yes, yes. Thank you.
Okay.
Okay. So here, hypnosis itself is based on the Indian psychology and Indian philosophy, and hypnosis itself is a new age. right? So it is intercorrelated terms. You can say that hypnosis itself is new age, and we need to also realize this thing that hypnosis is based on Indian psychology and Indian philosophy. So when we study the Western psychology, we study about the different therapy and different theories of the personality, how they perceive personality, right? This is how we create a foundation that how to view the human mind and human behavior. So, if we want to understand what hypnosis is, of course, we need to see hypnosis with respect to the Indian psychology and Indian philosophy. I would say this is the soul of hypnosis. It's not just clinical, it is also a lot of philosophy and psychology behind this. So, this is why I have brought a little comparison of what is the Indian psychology, the basic premises of Indian psychology, and the Western psychology. So the Vedic text says that human being is divine by nature. That is, Satchit Anand is the basic nature, which is also being, uh, supported by the quantum mechanics. While the Freud says that human being is animal by nature, governed by the pain and the pleasure. That is how we differ initially, right? And now we want to focus more on the hypnosis, a new age hypnosis, which is incorporating a lot of mindfulness and the quantum theory behind it. There's a basic paradigm which is different here, that we are divine by nature, right? And that is how we can say that you can transform yourself into more divine, and that is why you can transform yourself to more of potential for the transformation for the limitless. You can attend a lot of other things, but only with this understanding that human being is just animal by nature. Of course, that is very limiting belief, while here it is very expanding belief. The human being is unique manifestation of not just mind, body, and consciousness, while a sharp and meaningful distinction is between them. That mind, body, and consciousness are different. While in Western psychology, it is, the human being is just mind and body. And the term mind and body, or sorry, the mind and the consciousness is also used interchangeably, while it is different. So there is a very distinct distinction is being made here in our Indian psychology and Indian philosophy. Indian psychology add lights to remove the darkness, right? While the Western psychologists investigate cause in order to remove the darkness. So you see that there is an approach difference that, if you want to remove the darkness, first we will like to, figure out that why it is there. While in Indian psychology, we'll just try to add more of it. And that is what, the strength based psychology is all about, that you will try to add more of the strength to the client's life. That, these are the things that we need to focus so that all those things will remain very dormant. The Indian psychology is of transcendent, a study of the mind in relation to pure consciousness. Indian psychology is value oriented and adds a new dimension to the psychology, especially in its applied aspects. So, consciousness based psychology, that is what has been, researched nowadays. While psychology in the West is essentially transactional, concerned mainly with the mind as a cognitive instrument, and consequently, it is generally content with the exploring the sensory motor channels of thought, passion, and action. Indian psychology extends the scope of psychology to study biopsychosocial and spiritual process, while the Western psychology is limited to just the biopsychosocial model or the biopsychosocial processes. So we'll see that the aim of psychology is not different when it comes to Indian or Western. It's just the approach and the paradigm which is different. Now, what is Indian psychology? So, Indian psychology is a consciousness centered approach that explore inner experiences, self awareness, and mental well being. So, questions about the mind, self, and consciousness were at the heart of Indian psychology. So, here, what New Age hypnosis is, talking about is that if we want to understand the concept of hypnosis, which is very much essentially a Indian concept, though it has come through the Western channel. But if you want to really understand what New Age hypnosis is, we need to understand the Indian psychology, which is the soul of it, which is actually the basic philosophy behind it. And that is where, we incorporate our Indian psychology with a lot of our history and scripture. So, history of hypnosis in India. Hypnosis in Indian history is known as Sammohana, which is a part of Yoga Vidya, right? And has been practiced in India since Vedic times. Many yogis and sages practice self hypnosis during meditation to still their mind and induced altered state of consciousness. So now you see when you talk about some, old stories in our scriptures, which says that, they were doing some tapasya and, that is how they gained the knowledge because they have reached to the level of different consciousness. And so I assume that we are well versed with the concept of consciousness, which is a basic level of energy beneath all of us and which is interconnected with all of us. Right. So they get a lot of energy, a lot of knowledge when they reach to a different level of consciousness. So here, the very clear example of using hypnosis was in Mahabharata during the time of Gita Upadesh. So Krishna deals with the anxious person like Arjuna using the Gyan and the Karma Yoga. But he also used a lot of visualization, which is part of the hypnosis process. Using all the imaginary and visualization and intensive suggestions. Right? It took 18 chapters of suggestion to bring that change in Arjuna, in the mindset of Arjuna. So the hypnosis actually, this is my way of explaining that hypnosis is not just the Western concept; it is actually rooted in our Vedic scripture. So it's the Mandukya Upanishad which explain the different state of consciousness. Now they are studying the different levels of consciousness, but it is mentioned in our scripture, like they have discussed about the wakefulness, dream, and the deep sleep, as well as the extraordinary state, simply called the fourth state of consciousness. We call it Turiya, which is a countless consciousness contentless consciousness, and it is the state that the true self is directly experience, and it is also you can achieve through self hypnosis, through hypnosis and meditation. So now even the new research has also supported that the kind of relaxation we use in hypnosis is similar when it comes to we experience the deep relaxation using yoga nidra as well. Of course, here in hypnosis, the other person is using that state of consciousness or trance state in achieving certain desired or predefined results, the therapeutic goal. So it is the purpose is purely clinical or symptom reduction. So Indian philosophy, if we know about the Indian philosophy, it also talks about know the self, the Atman Vidhi. I'm not explaining much about it here because this presentation is about giving the whole idea of what new age hypnosis is and how it is correlated with our scriptures and our philosophy as well. So it is our philosophy, the six schools of philosophy, where it is basically the yoga and the Sankhya, which talks about the consciousness, the matter, the meditation, and the practical aspect of achieving the same level of you know deep relaxation. So if you want to learn more about hypnosis, this is also something we need to be aware of, or we need to study. So this is the basic idea, we are trying to incorporate here. So this is Yoga Patanjali, of course, which is a very practical guide to achieve, you know, Yes. So this is the end of my presentation. If you would like to ask anything, please ask me.
Thank you so much, ma'am. And it was lovely to hear. And it is so nice to know, like how you balance between the Western and the Indian. Like, okay, we do understand that it came from Western, but it does have roots in our Indian psychology. And it was very clear with your presentation. So thank you so much for doing that. And it was a very wonderful session. And your voice is very, very calming. So it was lovely to hear that as well.
Thank
I
you.
would also like to inform you that Dr. Palan is here. And again, thank you, sir, for being here. So if anybody wants to ask any question, I'll just check. Yeah. Just a second, sir. I'll add you
Yeah.
to the stage. Yes, Dr.
Aparajita, it
Palan.
was good opportunity for me to listen, Shweta.
Thank you,
So
sir.
very nice, Shweta. I'm very happy. Hmm? Wonderful job. Continue,
Thank you.
please. All the best to you.
Thank you, sir.
Thank
Thank you so
thank
much.
Good.
Uh, okay, ma'am, with this, I think we do not have any question for now. So thank you so much for being here and everybody who have joined here. We also have Dr. Ashutosh Srivastava from AHA Therapy. He's our Chief Scientific Officer. He has also joined in, and Dr. Palan and other people who joined in. Thank you so much for being here. Thank you for staying for this long. And we will be back with another session on next Sunday. So can't wait you to see there. And again, thank you, ma'am, for being here and for your
Thank you.
presentation.
Thank you, Art
Thank,
Therapy, and thank you, Aparajita.
thank you, ma'am. Bye bye. Take care.
Bye.